We studied a condition called heart failure with preserved ejection fraction, or sometimes also called diastolic heart failure. That's a very common condition. It affects mostly elderly patients, particularly elderly women. As of yet, no drug has been found to improve the condition of patients with this type of heart failure. We have lots of drugs and devices and procedures that improve outcomes in patients who have heart failure with a reduced ejection fraction, a big baggy heart that doesn't contract well. But half of heart failure occurs in people where the heart is normal size and it contracts normally, but it's stiff and it doesn't function properly and causes all the same signs and symptoms, shortness of breath when they try and exert themselves, swelling, and death, that the other type of heart failure does. So we have lots of drugs and procedures for the big baggy heart type of heart failure, but nothing yet of benefit for the other type of heart failure, which is half of heart failure. So in this population, this diastolic heart failure population, we studied the effect of a drug that's commonly used to treat erectile dysfunction, a drug like Viagra. And there was data from studies in animals and some studies in patients that would suggest that this drug might be very beneficial in this condition. So we looked at patients with diastolic heart failure, assessed their exercise capacity, their heart function, their symptoms, their characteristics, and then randomized them to be treated either with placebo or with this Viagra-type medication. Unfortunately, and very disappointingly, we found that this drug really showed no signal of helping patients with diastolic heart failure. The change in patients' exercise capacity was not different, whether they were taking this Sildenafil type drug, the erectile dysfunction drug, or whether they were taking placebo. And for patients who have this condition, unfortunately, it removes this on the list of things we felt might work. So it really is back to the drawing board. We clearly need to find something to improve these patients' symptoms and improve their outcomes.